Hi, Dr. Steve Rosman, and you may be asking the question, what the heck is a virtual practice? Well, for years and years and years, I spent time in many kinds of practices. All were brick and mortar, what you'd call office. So you walked in, you signed in, you spoke to someone behind the front desk, you waited for me, and if something else came up or another doctor came into the office, you may have to wait. Sometimes, depending on the weather outside, you had to deal with rain, you had to deal with heat, you had to deal with snow, you had to deal with cold. Here, virtual practice, and I've chosen to do this because this is the best care I can provide you with. Virtual practice means, number one, you don't have to deal with cold, snow, rain, traffic, waiting rooms, people sneezing, people being late, any of that at all. So we will be on time. You could be in your pajamas, not saying you have to be, and I'm not going to be in pajamas, but you can be in pajamas. You could be on vacation. You could be calling from Walgreens. You could be anywhere you want. It's your convenience, and we are on time. And you will get all the time with me, uninterrupted by people walking through the office or demanding my time. That's one reason this is important. Two, I cut my overhead. For years and years in my own practices, you can imagine what overhead is, what overhead can cost. By me doing that, I not only provide you with patient direct care, but I'm able to do it in as much a streamlined fashion as possible. With virtual care, I can also, if I need to, put together a team around you. And this team isn't limited to who can drive, who can I choose, who can I interview, who's only 20 minutes away and can get here for my office hours and on time. I can choose, because it's virtual, I can choose the very best people in the country to surround you with. And it's just as easy and safe and HIPAA compliant and private as when you're working with me. So you are surrounded, should you need it. You may not. But should you need it, you will be surrounded by the best team for you, highest quality, elite. So a virtual practice, it sounds different, but I'll tell you today, my colleagues are getting calls from consultants all the time to establish these practices because they are really effective. They really provide incredible patient care. And I'll tell you something else. My wife, who's a psychotherapist as well as a nurse, has been getting calls from consultants who want to teach her how to do virtual consultations like this for psychotherapy. Think about that for a second. The world is moving this way because this is the very best care. Convenient, economical, quality care. So, after having practiced for 20 years, chairing a department in a huge medical center, in my own practices as an associate working with other docs or solo, I have chosen this. I could always have done the others. I've chosen this because this is truly best for you. And after searching to find me, don't you want the best?